Just side that, no, just this side, because electors are the other side. Just face that way with your side. You're with me. Hello, ladies and gentlemen. How are you? Welcome. Welcome. My name is Vinnie DeMarco. I'm the president of the Maryland Citizens Health Initiative, the Healthcare for All Coalition, and we're thrilled for you to be here. Look at you all over here. This is wonderful. You are Maryland. And I have with me 1199 SEIU, key leaders in healthcare in Maryland and across the country. And we're going to start us going in some chants for everybody to sing together before we get the elected officials in here and start the program. We're here with a very simple message. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Save lives and create jobs. So let's do it together. I'll do the first part and you do the next part. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. A little louder next time. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Keep it going. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Now, these programs have been very successful. Why would anybody want to mess with this success? It doesn't make any sense. It doesn't make any sense. Yeah, they're greedy, somebody said. That's it. We're very proud that the Maryland congressional delegation, save maybe one, are united to protect the Affordable Care Act, to protect Medicare, and to protect Medicaid. And why are they going to do that? They're going to do that because the Affordable Care Act, Medicare, and Medicaid save lives and create jobs. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. We're not going to let them mess with that program, are we? We're not going to let them mess with it, are we? Our congressional delegation is going to fight very, very hard to make sure that nobody messes with the Affordable Care Act. Hundreds of thousands of Marylanders, millions of Americans have benefited from the Affordable Care Act. Let's have a big hand for President Barack Obama and the Congress for doing this. They accomplished something really tremendous because the Affordable Care Act, Medicare, and Medicaid save lives and create jobs. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. We're not going to let them harm us here in Maryland. You know, in Maryland, thanks to 1199, and I have Maryland Public Health Association and many other parts of our coalition, we were making progress even before the Affordable Care Act in expanding health care to hundreds of thousands of people. With the Affordable Care Act, we have been leading the way in doing it right. And there are people in here, this room, like Sherry Curtis. Where's Sherry Curtis? Raise your hand. Sherry works with a connector agency here, and she can get people enrolled. Anybody else work with the Maryland Health Benefit Exchange? You still have time to enroll in the Affordable Care Act. If you know someone who is not enrolled yet and wants to get enrolled, talk to Sherry or go to MarylandHealthConnection.gov. Get them enrolled. You know, the Republicans should notice that the enrollment period of this time has been the most successful one yet. The most successful one yet, ladies and gentlemen. Despite the threats to repeal the Affordable Care Act, more Americans have enrolled than ever before. There are over 20 million Americans who have benefited from the Affordable Care Act. How many people here in this room have benefited from the Affordable Care Act? Raise your hand. Whoa, that's great. We're not gonna let them take that away, are we? We are not. Are we gonna let them take health care away from people? No. Are we gonna protect Marylanders and Americans from the health care they absolutely have a right to? Yes, we are. And why are we gonna do that? Because the Affordable Care Act, Medicare, and Medicaid save lives and create jobs. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. This is a great success. This is one of the best government programs enacted since Medicare and Medicaid, the Affordable Care Act. To have a big hand for the Affordable Care Act and all that we have accomplished together. We have accomplished a lot together in America and in Maryland, and we're not going to let them roll the clock back. We're just not going to let them do it. So number one for you all, remember to make sure anybody you know who still needs health care goes to MarylandHealthConnection.gov and gets it before the deadline. The other thing we can all do together is contact our governor, Larry Hogan. Let me explain why. There are other Republican governors in this country, Rick Snyder of Michigan and John Kasich of Ohio, who are calling on Congress to protect Medicaid. Why can't Larry Hogan do it? If these other Republican governors can do it, why can't he do it? So you should all go to his website and demand that he join his other Republican colleagues in demanding that the President and Congress protect Medicaid. It would be a disaster. So that's number one, what I'd love you to do. Well, number one, get everybody insured. Number two, tell Governor Hogan to join other Republican governors in demanding that Medicaid be protected. And number three, help us to get the 3 more votes we need. Right now, ladies and gentlemen, 48 Democratic senators are going to stand firm for the Affordable Care Act. Why? Because the Affordable Care Act, Medicare, and Medicaid save lives and create jobs. So they're going to stick with it. We need 3 more votes to block the disaster that they're going to try to create. All of you got a sheet, an action alert. Does everybody have this? If you don't have it, get one. This list, the senators, the Republican senators from other states we can reach. If you know anybody in those states, contact them today when you go home, and contact them tomorrow and the next day, and get them to write to their senators and say to their senators, the Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Don't mess with any of them. Don't mess with any of them. You can do it. You can contact any friends and relatives you know in these states and get them to send that message. 3 more senators joining our 48 Democratic senators, and this disaster won't happen. So we need to all work very, very hard. The people in this room, the people across Maryland, the people across the country who benefited from the Affordable Care Act need your help right now. You going to give it? Yes. Who's going to make a call this afternoon? Yes. All right. Who's going to send an email to 30 people they know in all these states? And what are you going to tell them to say? The Affordable Care Act, Medicare, and Medicaid save lives and protect jobs. Don't mess with them. Don't mess with the Affordable Care Act. Don't mess with Medicare, and don't mess with Medicaid. If you do that, you can help us reach those 3 more senators who can with the 48 Democrats, block this disaster from happening. And ladies and gentlemen, I think it's going to happen. Are we going to succeed? Yes! Yes, we are. We absolutely are. And here come more people from 1199. It's a big hand for 1199 SEIU. I just want to say, no other organization did more to create the Affordable Care Act than 1199, and we thank them very much for being here and help us protect the Affordable Care Act. I also want to thank Karen Tyler and the entire team here at Bowie State for hosting us. Let's have a big hand for Bowie State. Thank you very much, Bowie State, it's a great institution, and this is a great room. I also want to thank Tess Wald and the 60 volunteers. Where's Tess? If you're a volunteer, raise your hand. Raise your hand if you volunteered to help make this happen. You did a great job. And thank you, Consumer Health First, for the great buttons. And a thank you again to every one of you for being here. Now, I think we're going to start pretty soon. The elected officials will be coming. But when they come, I want us all to greet them. And how are we going to greet them? We're going to say, the Affordable Care Act, Medicare and Medicaid, save lives and create jobs. Don't mess with them. The Affordable Care Act, Medicare and Medicaid, save lives and create jobs. Don't mess with them. And that's what we're going to say when they come in, all right? Ladies and gentlemen, we're going to say that together. And what the ACA keeps my husband alive. Let's have a big hand for that sign. Thank you. The ACA keeps my husband alive. I think that is great. That is great. And we know, all of us know stories, and you're going to hear from people today who were kept alive and whose lives were made so much better because of the Affordable Care Act. We're not going to let them take that away. Why? Because the Affordable Care Act, Medicare and Medicaid save lives and create jobs. Don't mess with them. Don't mess with any of them. And ladies and gentlemen, 3 people on this list are going to decide this. 3 people on this list are going to decide whether that person's husband can be kept alive, whether hundreds of thousands of Marylanders and millions of Americans will retain their health care. So I can't emphasize to you enough the importance of making your calls to the people you know in these states. They need to hear from you that we can save the Affordable Care Act, we can save Medicare, and we can save Medicaid. Why are we doing that? Because the Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Don't mess with them. Don't mess with them, Congress, because you will regret it. We will all regret it. But I believe if we all do what we know how to do, we can prevent this disaster from happening. I know 1199 is going to call, right? Yeah. 1199 is going to make sure people who are part of 1199 in those states call their senators. And each of you are going to do the same. Because with 3 of these senators working with the 48 Democrats, this disaster won't happen. Why do we need it to happen? Because the Affordable Care Act, Medicare, and Medicaid save lives and creates jobs. Don't mess with them. That's what we're going to do. We're going to make sure they don't mess with these programs. These programs have been in place, Medicare and Medicaid, as you know, since the 60s, and they've grown and helped millions and millions of Americans. Now the Affordable Care Act is a lot younger, but boy, is it working. We hear stories constantly of people like this person here who signed us up, who were kept alive because of the Affordable Care Act, whose lives are much better, who can afford to eat, who can, was there another sign here? No Obamacare, I would have been dead. Let's have a big sign, a big hand for that. No Obamacare. No Obamacare, I would have been dead. There, ladies and gentlemen, that's proof of what we've been saying. So let's say it again. The Affordable Care Act, Medicare, and Medicaid save lives and creates jobs. Don't mess with them. That's our message. And I thank you all for being here to get this message through. Again, in Maryland, every single one of our congressional delegation, except one, are fully behind keeping the Affordable Care Act, Medicare, and Medicaid. Right, but we need 3 more Republican senators to protect these programs. And together, we're going to do that. And let's not forget contacting Governor Hogan, because there are Republican governors out there who are publicly calling on Congress not to mess with Medicaid. Why can't Larry Hogan do that too? He certainly should. He certainly should. Thank you, Matt. All right, I want to thank the elected officials who are here, and one of them is one of my heroes, County Executive Rashawn Baker, right here from Prince George's County. Thank you, Rashawn. You're a great man. And Baltimore County Executive Kevin Kamenetz, who came down from Baltimore County and is one of our progressive leaders also. Yay, yay, Kevin. Congressman Steny Hoyer. Nobody did more to get the Affordable Care Act than Steny Hoyer. We love Steny. Congressman Anthony Brown, our former lieutenant governor, a great new congressman. We love the congressman. Delegate Kirill Resnick from Montgomery County, Chair of the Appropriations Subcommittee on Health. All right, Kirill. Dr. Lena Wen, the Baltimore City Health Commissioner, a wonderful woman. You'll be hearing from her. We have Ryan Middleton representing Senator Ben Cardin. We love Ben Cardin, don't we? We love Ben Cardin. Delegate Dan Moorheim, the doctor in the House of Delegates. Thank you, Dan, for being here. Alderwoman Sheila Finlayson, City of Annapolis. One of our public health heroes, Senator Rich Madaleno from Montgomery County. Yay, Rich. County Council Member Todd Turner. Yay for Todd. County Council Member George Leventhal from Montgomery County. Yay, George. Another public health leader. Linda Mahoney. Yay, Linda. Jan Oliver, another hero, and one of my all-time heroes, Attorney General Brian Frosh. Yay! Hey, Brian. And Congressman John Delaney, who's also fighting hard for the Affordable Care Act. Congressman John Sarbanes. We love Congressman Sarbanes. And the man who put all this together, Senator Chris Van Hollen. Yay! Are they coming? They're coming out soon. Everybody's coming out soon, I'm told. I'm sweating. I don't know if you are. But, ladies and gentlemen, we got to practice our chant to greet them with, all right? The Affordable Care Act, Medicare, and Medicaid save lives and creates jobs. Don't mess with them. The Affordable Care Act, Medicare, and Medicaid save lives and creates jobs. Don't mess with them. We're going to keep them from messing with them, right? Because all of you are going to do the 3 things, right? You're going to make sure everybody gets enrolled. You're going to go to Larry Hogan's website and say, do what those other governors are doing, all right? Call on Congress to protect Medicaid, and you're going to get your relatives and friends in these states to contact these senators. And what are you going to say to them? The Affordable Care Act, Medicare, and Medicaid save lives and creates jobs. Don't mess with them. If everybody sends that simple message, it'll really hear it. We want them to hear that the people of Maryland, the people of America, will not go backwards. We will not go backwards. It was very hard. We will not. Oh, here they come. Here they are. Senator Chris Van Hollen. Congressman Anthony Brown. County Executive Mike Leggett. County Executive Kevin Kamenetz. Anthony Brown. Commissioner Lena Wen. Congressman Steny Hoyer. Congressman John Delaney. Welcome. Come on up. Congressman John Sarbanes. That big hand. very much. You can too. All right, ladies and gentlemen, we're about to start, but how are we going to greet everybody? The Affordable Care Act, Medicare, and Medicaid save lives and creates jobs. Don't mess with them. That's our message to you all. And Senator Rich Madaleno, I want to introduce one of my all-time heroes to start us going. This man, while in the Maryland General Assembly, fought the gun lobby, fought the tobacco lobby, fought and won for public health, and then he went to Congress where he's been fighting for the Affordable Care Act and all our programs. He's one of the real heroes in Maryland, and America are so lucky he is where he is. Senator Chris Van Hollen.
Thank you. Thank you, Vinny. Thank all of you out there. Thank you, Marylanders. Are you fired up? Ready to go? Fired up? Ready to go? Are you ready to fight like hell to save health care in America? Are we going to allow Donald Trump to insult people on his tweets and get away with it? No. Look, we got a lot of work to do. We got a lot of work to do together. I'm so proud of everybody who's here. I'm so grateful for all these individuals who have joined us, who Vinny DeMarco introduced. And let's give it up for Vinny DeMarco. You're going to hear from some of my colleagues in a minute, but we are all gathered here, all of us and all of you in this room, united to send a very simple message to Donald Trump and the Republicans on Capitol Hill. We are not going to allow you to turn back the clock on progress in the United States of America. We are not going to allow you to drag us backwards. And we are now in the very first battle. We are engaged in the very first battle of many battles to come. And that is the battle to save the Affordable Care Act and prevent our health care system from descending into chaos. Are you ready to make sure that we win this fight? Because we will win this fight if Americans are united, and you're part of gatherings throughout the United States of America that are taking place today. Now in 2010, all of you did a great thing. You made it possible for many of us on your behalf in 2010 to pass the Affordable Care Act. The Affordable Care Act, as we gather here at this moment, there are 22 Affordable Care Act who would not otherwise have had it. That is a big accomplishment. We filled a very big gap in our health care system. The share of Americans who are uninsured today, is much lower than at any other time in our history by far. You helped do that. Now, all of us know that we can make improvements to the Affordable Care Act, but there's one thing we also know. We are not going to let them destroy it and pretend that they've got something better to put in its place. Hell no. Now, I want to say to the tens of millions of Americans who are not in the Affordable Care Act exchanges and who do not get their health care through expanded Medicaid, that you too have had great benefits from the Affordable Care Act. And those tens of millions of Americans who may not think they're benefiting from the Affordable Care Act are going to be in for a very rude awakening if this goes away. And so it's our job to alert all of them about what is on the horizon and what will happen to them, including the tens of millions of Americans who get their health care the way most people do, through their employer. You know what's going to happen to those Americans? their premiums are going to go way up and their health protections are going to go way down. You know why? Because those Americans are benefiting from the fact that 22 million of their fellow Americans now have health insurance. They're not showing up at the last minute in the emergency rooms to get their health care. Who do you think was paying for that emergency room health care? Everybody else was paying. Higher premiums and higher taxes, which is why, and here's the secret that apparently no one knows, all those tens of millions of Americans who get their insurance through their employer, their premiums have gone up very, very slowly, historically slowly since the Affordable Care Act was passed. And if you get rid of it, those premiums are going to go up because all the people who currently get their health insurance through the Affordable Care Act, they're going to be back in the emergency room as their first line of health care. So premiums are going to go up. Patient protections are going to go down. Everybody in America now has protection against discrimination based on pre-existing conditions. They can't say no to you. They can't say no because you have asthma or diabetes or because your child has a condition. And guess what? If you're over 18 and still younger than 26 and you're now on your parents' health care policy, they can boot you off of that policy when you get rid of the Affordable Care Act. So it is there for every single American. Seniors on Medicare, I want all of you to talk to seniors who you know. The Affordable Care Act, people don't know it. It strengthened Medicare. First of all, extended the life of the Medicare Trust Fund. It also reduced dramatically the cost of prescription drugs for seniors by closing the donut hole. And you know what? Seniors Part B premiums are going to go up if you repeal the Affordable Care Act. And they won't have access to free preventative care like cancer screenings if you get rid of the Affordable Care Act. So, saved your life. This is about saving lives, and you're going to hear some stories. So, thank you for being here to call a sham, because for 7 years, my colleagues and I have heard our Republican colleagues say they're going to repeal and replace, right? This Donald Trump says he's going to replace it with something much better. But when you ask them what it is, they can't tell you anything. Let me tell you, if you had a house, let's say you had a plumbing problem. It wasn't a perfect house. It was a house, you had a little leak in the pipes, and someone came up to you and said, you know what, here's what we're going to do. We're going to get you a better house. But first we're just going to blow up your house. We're going to set it on fire. No more house, and trust us, we're going to build you a better one down the road. You'd be without a house. 22 million Americans will be without a house of health care if we do it that way. So we're going to do this. You're going to hear from our colleagues about the fight we're in. I'm going to say a word about the Senate and then turn it over to a great leader in the House. In the United States Senate and in the House of Representatives, in the first 10 days of the new Congress, the Republicans began the process of destroying the Affordable Care Act and creating chaos. They laid the groundwork. But they've got a long way to go before they can actually get it done. And it's our job to stop them from getting it done. Now, in the United States Senate, there are 48 members of the Democratic caucus. We need 51 votes. That means we need 3 Republican senators to explore their conscience and do the right thing. All of you have a handout. You have a yellow sheet of paper that identifies all the Republican senators. Here's what we want you to do. We want you to contact your family, your friends, your colleagues in all the states that have Republican senators on that list. And we want you to ask them to contact their senators and tell them to do the right thing, and tell them that they are going to hold their senators accountable at the ballot box if they take away their health care. Can you do that? Because we need action out of this. Now, I'm going to turn this over to a great leader. Before I do that, I want to say on behalf of Senator Ben Cardin that he has been front and center in this fight with all of us who are here today. He's been front and center. He had a previous commitment that it was really important that he keep, but I want you to know he is here with us. He is fighting on the floor. He's fighting in Maryland. We're going to do more rallies as we go. Our great Attorney General, Brian Frost, was going to join us, but his mother took ill. And Nancy Kopp, our treasurer, also had another commitment. But you've got a lot of other folks here who are standing with you to make sure we get the job done. And the person who has been leading this effort in the House, the person who worked side by side with Nancy Pelosi in collecting the votes in 2010 to make this happen, was a great Marylander, the great representative from this district, a great leader in the state of Maryland, and a terrific leader in the United States of America, our own Steny Hoyer.
Vinny, welcome to the 5th Congressional District of Maryland. And Anthony and I welcome you to Prince George's County, Maryland.
I love Prince George's County.
And what a great assistance Bowie State University gave to having this rally here on behalf of Americans Healthcare. I am pleased to be here with my friend, my former colleague in the House of Representatives, and now our great junior senator, Ben Cardin made me say that, our great junior senator from the state of Maryland, Chris Van Hollen. Now, while Ben Cardin couldn't be here today, I want all of you to understand and know, and if you want to come, we'd love to have you on Tuesday, this coming Tuesday, at Mount Enon Baptist Church in Clinton, Maryland. Ben Cardin and I will be having another rally to let Washington know that we are not going to sit idly by and let the Affordable Care Act be repealed. Ladies and gentlemen, as Nancy and I and Democrats in the House and Democrats in the Senate, and Ben Cardin, by the way, let me say, is one of the health care experts in America. He was in Maryland and made a real difference on Maryland health care, and he has been at the national level making a real difference on the Affordable Care Act and health care for all Americans. Now, when we were doing that, there were a lot of people showed up at the Capitol. They called themselves the Tea Party. I call them the Me Party. And I call all of us the We Party. We are in this together. We care about our fellow citizens. We care about our seniors. We care about our young people. We care about those with disabilities. We care about those with pre-existing conditions. We care about those who have a health care cost that they can't afford and therefore go bankrupt. We care about them. That's why we're for annual limits. That's why we're not for lifetime limits or annual limits being precluded. I'm a grandfather. And I tell people, congratulations, that I didn't do much to do that, but thank you very much. I'll pass that along to my daughter. And I tell people, why are you worried about somebody else's health care? Because I have a grandchild and she's going to go to school. And I want the child in front of her healthy. And I want the child on her right healthy. And I want the child on her left healthy. And I want the child behind her healthy, because if they're not healthy, she's not going to be healthy. We are in this together. We are the we party, not the Democrats or the Republicans, the we party. And we know that America, the richest land on the face of the earth, can make sure all of our fellow citizens, not just some, not just the wealthy, but all of our fellow citizens, have access to affordable, quality health care. That's what this rally is about. That's what America is about. That's what Obamacare is about. And we're going to win. We're going to win because they don't have an alternative. It's a shell game. You know, they got those 3 shells. The problem is there is no P under any one of those shells. They've been spending 7 years and they can't find the P. I don't want you to take that too far now. My. The we party will prevail. And I want you all to understand this. We had an election. And over 2 million more Americans voted to keep the Affordable Care Act than voted against the Affordable Care Act. We represent the majority of Americans who understand that we are in this together. And if America is going to be strong and healthy and vibrant and successful, it will be because we take care of one another. Okay. Now, ladies and gentlemen, we have a great county executive in this county. I'm not sure I heard that, what was... What? Right. Let me tell you something. I understand my friend John Lewis. But John Lewis and I and others are going to be doing our job on the House of the floor of the House of Representatives and make sure that they do not succeed. We will not walk off the field. And you're not walking off the field. We're engaged because we are the we party. Ladies and gentlemen, I want to introduce now my dear friend who throughout his public career in the House of Delegates as county executive has understood that we are in this together. That if somebody that is my neighbor or my friend or somebody I sit next to on the bus going to work does not have access to affordable quality health care, we're not going to be the healthy, strong nation we want to be. That's why he's been such an effective, incredible leader. Ladies and gentlemen, the county executive of this county, of Prince George's County, Rashawn Baker.
Woo. Give it up for Stiddy Hoyer. All right, our leader. Vinny, I was driving past here and I heard you were having a little party. A few of your closest friends, you know, they're going to discuss some issues. I don't know if you know, but the overflow room is packed. Right. Give yourselves a round of applause. Certainly want to thank Chris Van Hollen, our great senator. Isn't it great to have him there? You know, first of all, welcome to Prince George's County. We're so glad to have you here. We need your help. You know, when I was in the House of Delegates, we were dealing with the issue with Prince George's Hospital. It was going down. And the reason that hospital was going down was because it was used as, the emergency room was used as the primary care physician.
So the uninsured and underinsured were dragging the hospital down. Think about that for a minute. In the wealthiest country, in the wealthiest state in the world, people were going without health insurance. People were relying on the emergency room for primary care. That makes no sense. That is disgraceful. And so along comes President Barack Obama and says, that makes no sense in this great country. We're going to change it. Who would be against providing health care? Who would be against providing insurance? Because of the Affordable Care Act, Prince George's County is going to build a new, not Prince George's County Hospital, but a new regional hospital that will take care of Prince George's County and the southern part of this great state. That is because of the Affordable Care Act. So the rally here today, the rally cry is to not only to make sure that every woman, man, child in this great country, in this great state has health care, but to make sure that we keep it so that we can build that great hospital to serve more Marylanders and to keep them healthy. Will you stand with us? Yeah. Will you do everything you can to make sure it doesn't go back? As I step away, this is really us talking to the choir. You're the choir. You're the choir. You get it. What we have to do when we leave this place is to make sure the world hears our voice, to make sure they understand how important this is, how we're not going to be turned around. That means we're going to have to organize, to work, to march, to protest, to make our voices heard. That's what we need to do. That's what I'm going to do. Will you stand with me? Let's get it done. God bless you.
Let's hear it for County Executive Sherman Baker, one of our all-time heroes. Ladies and gentlemen, let's repeat. The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Don't mess with them. And since we started, we have a few more wonderful people come here. Congressman Jamie Raskin, a new congressman from Montgomery County. Yahoo! A great public health leader. And two wonderful leaders in the Maryland State Senate, Senator Roger Mano from Montgomery County, Senator Paul Pinsky from Prince George's County. Hey, Paul, Roger. And Delegate Jimmy Tarlow from Prince George's County. Great, wonderful, wonderful leaders. You know, oh, Ann Healy, Delegate Ann Healy, thank you for being here. Thank you for being here and being great public health leaders. Ladies and gentlemen, the real reason we're here is to hear from people like the person you're going to hear from next. Someone who's benefited from the Affordable Care Act. And when you're calling those senators, like Senator Van Hollen said, the people in those other states, tell them this story. Ola Ojewumi has a great story to tell you, and I'm proud to introduce Ola to tell it to you. Ola?
Hi, everyone, and thank you so much to Congressman Hoyer for helping me up on the stage. I might look like the average 26-year-old young millennial, but I'm not exactly that ordinary. I'm the survivor of a heart and kidney transplant. Yes. I had those surgeries at age 11. And at 25, last year, I became the survivor of a rare post-transplant cancer. I received chemotherapy at Johns Hopkins, and the Affordable Care Act literally saved my life. It's been thanks to the work of President Obama, Congressman Hoyer, and Senator Van Hollen that I'm standing here before you today. Patriotism is supporting your fellow man and not believing we should repeal this law. because of the misconception that the ACA is too expensive or imperfect. Donald Trump and others that support the repeal of the ACA don't understand what it means to have medication that costs $2,000 for 30 days. My reality is 22 pills a day. And I'm not on Medicare, I'm not on Medicaid. I have a job, a full-time job. I'm a college graduate, and I also run a small nonprofit that sends disabled youth to college and provides them with money for it. This happened because of the politicians behind me and the advocates like you that don't believe people with disabilities are not worth saving. We have a lot to contribute to the world, and the Affordable Care Act not only saved my life, but the lives of my friends. In college, I knew transplant patients who would literally register for school every year, pay in loans tuition, and withdraw and fail just so they can stay on their parents' insurance. The Affordable Care Act means people like us with pre-existing conditions can no longer be denied health care. It also meant that I could stay on my parents' insurance until I was 26, and I turned 26 2 weeks ago on New Year's Eve. And these are two provisions that Senator Van Hollen fought hard for. So I'll end this by saying that allowing our fellow man to die because of $1 is not patriotism. It's choosing death over dignity. But we stand here unified today to say yes to affordable health care and no to a repeal without a replacement. Thank you all so much for allowing me to speak my mind and for this opportunity, and thank you all behind me.
Ola, terrific. Give a big hand for Ola. Yay, Ola, wonderful. Isn't Ola proof that the Affordable Care Act, Medicare, and Medicaid save lives and create jobs? Yes. Don't mess with them. Ladies and gentlemen, we are going to protect the Affordable Care Act. We won't let it be destroyed. You know, November 8th had some bad things happen. We all have to admit. But some really good things happened. Maryland elected some great people to Congress, except one. And among those was Senator Chris Van Hollen, and also new Congressman Jamie Raskin and Anthony Brown. And ladies and gentlemen, I had the honor of working with both of them when Anthony Brown was Lieutenant Governor and Jamie Raskin as Senator, and there are really no better public health leaders. The two of them really know what they were doing, and I'm glad they're where they are to fight to keep the Affordable Care Act and the fight for progress. It's my great privilege to announce a wonderful man. We're so lucky he's in Congress, Congressman Anthony Brown.
Thank you. Thank you. Let's give it up for Vinnie DeMarco and his crew, and thank each and every one of you. Look, I'm gonna be brief. Let us say on this day of action, here and communities around this nation, Republicans in Congress, opponents of the Affordable Care Act, hear our story. Hear Ola's story. Because the Affordable Care Act works. It's an American story. Our effort to protect and preserve the Affordable Care Act isn't about one man. We love President Obama. His legacy will endure, but our fight isn't for one, it's for 21 million Americans who have benefited from the Affordable Care Act. Hear our story. Hear our story. It's the 23-year-old on the family farm in the Eastern Shore. And maybe he or she didn't vote for President Obama or Hillary Clinton. But you know what? Whether they graduated college or not, whether they're going to work on the family farm or not, they sure are glad that they're covered on their parents' health insurance until the age of 26. Hear our story. It's a story not of Democrats and Republicans. It's not a story of the rural America and urban cities. This is a story across America. Just like Ola's. Families who are relying on expanded Medicaid because a family member had a pre-existing condition. Small business owners don't work for a large employer. They need that health insurance, and they're getting that health insurance. So I say, hear our story. The Affordable Care Act works. Hear our story. We will protect our care. We will protect our care. We will protect our care in Congress, and with you, we will do it around the country. But as County Executive Baker talked about, we got to protect our jobs. Because when they repeal, if they do, and with you, we won't let them, the Affordable Care Act, there will be more uninsured people. Those uninsured people will show up at Anne Arundel Medical Center, at Doctors Hospital, at Kaiser Permanente, at MedStar Health. So not only will you be waiting in the emergency room at 2 a.m. in the morning after showing up at 7 p.m. with your child who has 104 degrees, but we are going to see those hospitals reduce services. They are going to lay off doctors and nurses and technicians. Our local economy will weaken. That regional medical center, I'm going to put a finer point on it than the county executive did. It will not come to Prince George's County if they repeal the Affordable Care Act. That's what we're facing. Major medical centers like Johns Hopkins, University of Maryland, they will cut research dollars. The dollars that we desperately rely on, not only to fight, but to eventually cure cancer. Not only to treat diabetes and obesity, but improve the quality of life with those who live with it. To reduce infant mortality and to, yes, one day eliminate health disparities that are the scourge of communities across this country. That is what is at risk. Hear our stories, the Affordable Care Act. Let's protect our care and let's protect our jobs. Thank you for being here.
Thank you. And you know, ladies and gentlemen, we heard from County Executive Rashawn Baker. Now we're going to hear from another great leader, County Executive Ike Leggett, who for years has really led in public health and public safety and been a great leader for our state. Where's Ike Leggett? Ike Leggett.
Thank you, thank you. Thank you. Don't tell County Executive Baker I was just about to welcome you to Montgomery County. Montgomery County's in the house? Yeah. Montgomery County's in the house? Let me tell you why I say that. In many ways, we are fortunate in Montgomery County compared to many other jurisdictions. It is a large jurisdiction. And in many ways, comparatively, it is better off than many other places. We have over 1 million residents in Montgomery County. But guess what? Nearly 10% of those are having the Health Care Act, Affordable Care Act, benefit more than 10% in Montgomery County. So if that's happening in Montgomery County, you know what is happening around the rest of this nation and around this entire state. We need this help. But sometimes we get a little bit too sophisticated. And you know, we get too sophisticated, and the other side has done a terrific job with this. They make it quite plain, quite clear. And you saw that the other night when Paul Ryan had his town hall meeting. And the man from Arizona, the small business person, simply said, without Obamacare, I would not be alive today. That's it. Repeal, people die. That's simple. Repeal, people die. That's simple. Certainly, there are changes that we should make. Certainly, there are things that we could do better. But repeal, people die. We don't want people to die unnecessarily. So for us, it's a simple message. Let's get behind this. Let's fight. Let's ensure that we're in this to win it. Because when you repeal, people die. Thank you.
Thank you. Thank you, County Executive. And we have two great congressmen here also. Congressman John Sarbanes, who fought really hard on the committees to make the Affordable Care Act happen. He knows it better than anyone else, and he'll protect it. There he is.
Thank you, Vinny. Hello, everybody. This is an important weekend. Dr. King said that people everywhere deserve 3 meals a day for their bodies, education and culture for their minds, and dignity, equality, and freedom for their spirit. Freedom from want. Freedom from fear, the gripping fear, the paralyzing fear that you won't be able to see a doctor when you get sick. This weekend, I'm thinking of 2 great Americans, Dr. King and President Barack Obama. Two recipients of the Nobel Peace Prize. One a prophet who had a dream. The other a president who in many ways embodies that dream. On September 26, 2013, do you know where President Obama was? Does anybody know where President Obama was on September 26, 2013? I'll tell you where he was. He was here in Prince George's County at a rally for the Affordable Care Act. And he said, in the richest nation on earth, you shouldn't have to go broke just because you get sick. That in the United States of America, health care is not a privilege for the fortunate few, it is a right for everybody. The Affordable Care Act is the legacy. It is the intersection of the vision of what Dr. King saw for this country and what President Obama decided to put in place for this country, lifting people up, giving them hope again. That's what it is. That's what the Affordable Care Act is all about. 22 million people who didn't have health care before who have it now. How many of you knew that it was 22 million people? Raise your hand. Why am I asking you that question? Because they did a survey the other day, and half of Americans don't know that. Which means you have an assignment. You got to make all those phone calls that Chris Van Hollen talked about, but you also, any room you're standing in, any room you're sitting in with your coworkers or your family or your friends, half the people in that room do not know what the Affordable Care Act did. Tell them. Tell them what it did. Tell them the 22 million people who were left out are now part of a healthcare system that can lift them and their families up. Tell them the other numbers. 3 million young people who can now stay on their parents' health care until age 26. Tens of millions of seniors who don't fall into that donut hole anymore because we're closing that in terms of their prescription drug costs. Millions of people. Tell them about the numbers. But don't just tell them about the numbers. Remind them of the stories. You heard one here today from Ola. There's a sign right there that says the ACA keeps my husband alive. Tell them the stories. Because you know the stories. You know what they were before the Affordable Care Act. Stories of hopelessness and pain and suffering that the Affordable Care Act turned into stories of empowerment and hope and confidence in the future. Behind those numbers, those tens of millions, are the stories of people whose lives have been changed. That's what we're fighting for here. That's why we got to hold our progress on the Affordable Care Act. The other part of that quote from Dr. King is he said, what self-centered men tear down, other-centered men and women build up. We have to build up the dignity of people, not let it be torn down. We have to reach for our other-centeredness as Americans and say we're going to lift this country up. Will you help us fight to keep our progress? Will you help us fight to keep the Affordable Care Act? Will you help us fight for what, in President Obama's words, are to ensure that health care in America is not a privilege for the fortunate few, but is a right for everybody? I think we got something here. Let's keep going. And should I introduce time? And somebody who's been fighting from the day he got there for the Affordable Care Act and for that vision of lifting people up. He's part of the team. He's part of who you put on the field. We're not going to cede the field to anybody, to Donald Trump or anybody. Part of that team, Congressman John Delaney. Give it up.
All right. Let's hear it for John Sarbanes. And let's hear it for the greatest warrior we've got here today, Vinnie DeMarco. Because that's what we are. We are warriors. This morning you all kind of got up in the morning and you were good Democratic activists who cared about your fellow citizens and cared about your country. But you know what you are now? You're healthcare justice fighters. You're healthcare justice fighters, because that's what we're fighting for. Is healthcare a basic right? Let me see some of the signs. Everyone put their signs up. All right. I mean, look at some of these. ACA keeps my husband alive. Save our coverage. Heal America. Tax Wall Street. Obamacare. So did I. How much did Obama care? Yeah. I mean, to do something as transformative as this. There's a John Lewis sign over there. Yeah. If we let this Congress repeal the Affordable Care Act, the person who's going to sign it into law started his campaign by insulting John McCain and is starting his presidency by insulting John Lewis. I mean, come on. Come on. That's why we have to fight, right? Because the Republicans are not amending the Affordable Care Act, right, to build on its strengths and overcome some of its weaknesses. I mean, healthcare is a sixth of the economy, right? We reformed it, right? There are things we can do. Are they doing that? No. Right. Are they, right? And one of the things you should do, right, because if you were fixing this thing, one of the things, hey, here, listen what I'm going to say here. If you were fixing these things, one of the things you would do is let the government negotiate drug prices with pharmaceutical companies. Right? So if the Republicans were coming to Congress, right, and amending the Affordable Care Act, building on its strengths and doing things like that, we'd be the first in line to support them, right? Or if they were repealing this thing, but they had some other fabulous health care law, right, that they had worked on for 8 years, instead of saying no to President Obama on everything he wanted to do, if they had shared it with the American people, if they had let people comment on it, and it was good, and it did the three things the Affordable Care Act did, which is to insure 20 million people, to make sure the quality of health care, particularly for women, I have 4 daughters, I care a lot about this issue, was high. And it lowered the cost of health care. No one talks about that. Health care costs as a percentage of our economy are finally not going up faster than inflation. If they had a plan to do that, we'd be supporting it. No. What do they have? They have a cold, hard repeal and let the chips fall where they fall. That's their plan. And why are they doing it? Why are they doing it? Greed. I'm going to tell you another reason they're doing it. Because they've been lying for 8 years. Right? They've been lying for 8 years about this law. They haven't had the courage or the conviction to tell their constituents what this law is doing for them. They haven't had the determination to work to improve this law. They've been lying for money and they've been lying for politics, and now they're going to go through with it. And that's why it's so important that we have this fight. See, the Affordable Care Act was on the ballot in 2 national elections. People forget about that. This was on the ballot in 2012. If you don't think the whole election between President Obama and Mitt Romney was about the Affordable Care Act, you're forgetting what the world was like 4 years ago, right? We voted on this as a country. We voted on this as a country. And then guess what? We voted again on it this time. And who got more votes? Who got more votes? All right. So we're in a tough spot in the Congress. We're in a tough spot in the Congress. We're in a tough spot in Washington. But we're not in a tough spot outside of Washington because we got you. We got healthcare warriors who are fighting for justice, who are willing to turn out and tell the American people what's really going on with this law and what's at stake if we let this be repealed. That's why we got to be here. Are you ready to fight? Yeah. Are you ready to fight? Yeah. God bless you all. Thank you.
Thank you, John Burke. Let's hear it for Congressman John Delaney. And now, ladies and gentlemen, let's hear another story you can tell those people in other states. Kevin Estes. Come up, Kevin. Where are you? Kevin. All right, come on up, Kevin. All right, Kevin, tell your story. Yeah, it's hot in here.
It's hot in here, Evan. All right, good afternoon, everybody. I've shared my brief story already with Paul Ryan, Mitch McConnell, and with Governor Hogan a couple of times, so I'll share the brief story with you. When the Affordable Care Act became law, I was unemployed and uninsured. Now, I mean, you can't afford COBRA without a regular paycheck. So when the law was passed, I signed up for the Affordable Care Act online, and despite all the grief it got in the press, it was pretty simple because I used a navigator that helped me. And it took about a half hour online, and about 10 days later, my card showed up to show that I had coverage. So anyway, not long after I signed up, I was involved in a hit-and-run car accident, and side effects from the meds that I was given caused me to need to be in the hospital for a week. And shortly after that, the following month, I was diagnosed with multiple myeloma, which is a blood cancer. But thanks to the great care that I was getting at Johns Hopkins, I'm alive and feeling good. And thank you, President Obama, for the Affordable Care Act. Now, some in Washington want to dismantle the Affordable Care Act, and my response is, taking away medical coverage for 22 million people is no way to make America great again.
Thank you, Ben. Let's have a big hand for Kevin. Kevin Estes. And ladies and gentlemen, when you call all those people in these other states to contact their senators, tell them Kevin's story and tell them Ola's story. Like I said before, some great things happened on November 8th, and one of them was the election of Jamie Raskin to Congress. And Jamie is going to be a wonderful public health leader.
Hello, Maryland! I want to tell my medical story, if that's all right. Because I had the good fortune when I was in the Senate to be the floor leader for marriage equality in Maryland with my friend Rich Madaleno. And over the course of that process, I wasn't feeling so good, and I went to the doctor. And I would learn over the next few months the difference between misfortune and injustice. Because if you wake up one day and you love your job, you love 2 jobs that you have, and you love your constituents, and you love your state, and you love your family, and a doctor tells you that you've got stage 3 colon cancer, it can happen to anybody. It can happen to everybody, and we should never forget that it happens to our people every single day, which is why we're Democrats, because it does. And because I had health insurance, and I had good doctors at Anne Arundel Medical Center, and I was able to do my chemotherapy there. I was able to continue leading the floor fight for marriage equality with my friend, the great Rich Madalino, who's here today. And when it was all over, Maryland extended equal civil rights to hundreds of thousands of our people in the state of Maryland. And when it was over, you know, when you're floor leader, you get to make a little speech. And I got up and I said that in this process, I did learn the difference between misfortune and injustice. Because if you wake up and the doctor tells you that you've got the diagnosis, this or any number of other diagnoses, it can happen to anybody. It is a misfortune. It's part of life. But if you can't get covered on health care because you're married to the wrong person, or you can't get covered on health care because you're unemployed, or you can't get covered on health care because you're poor and the richest society in the history of mankind has refused to extend health care to you, that's not a misfortune, that's an injustice, because we can do something about that. And we did do something about that in Maryland that day. Now, my friends, I just started a new job 2 weeks ago. And thank you very much. And before I got a computer, before I got my voting card, I went downstairs in the basement of the Longworth building and I signed up for health insurance. Because I get that as part of my new job as a member of the U.S. House of Representatives. And there were other people in line behind me, and I thought, these people are seriously not going to be coming in here, signing up for health insurance at the expense of the American people through the Affordable Care Act, and turn around and vote to deny 22 million Americans health insurance. Are they? Are they going to do that? But you know what? I get to the House floor, and what do I learn? They want to voucherize Medicare. They want to downsize Medicaid. They want to attack Planned Parenthood. And they want to dismantle the Affordable Care Act. Now, are we going to let them do that? You know, we're here all as good Democrats. I wish there were some Republicans with us. But in a spirit of bipartisanship, I do want to invoke our last great Republican president, Abraham Lincoln, who spoke of government of the people, by the people, and for the people. We need health care of the people, by the people, and for the people, for everybody. That's what we need in the United States of America. Health care for everyone. Now, I want to say this for Donald Trump, who I may well be voting to impeach over the next year or two. But wait. I want to say this. I want to say this for Donald Trump, because you can find it online. He has said several times in questions about health care that we need health care for everybody. Look it up. I'm not kidding you. He has said we need a universal plan. Now look, he campaigned as William Jennings Bryan. He is governing as William McKinley, okay? He has turned his administration over to the most right-wing elements of the country. And so he's opened the door, and they're coming in, and they want to dismantle our whole healthcare system. But you know what? They must not know who we are. They must not know who we are, because we are the people in the country that built Social Security, and we built Medicare, and we built Medicaid, and we built the Affordable Care Act, and we are not going to let them tear it down.
Thank you, Jamie. That was great. Let's have a big hand for Jamie Raskin, great new leader in Congress. Ladies and gentlemen, we're going to hear another story. Ramiro Cruzor. Ramiro, come here and tell your story. Ramiro, where are you? Ramiro, tell us your story.
Good afternoon. Wow.
Hello.
A couple of days ago, I think I was feeling alone and kind of depressed. And I was told that I needed to tell my story. And I look out here and I see these signs about ACA saved my husband and saved my life. It saved mine. I was told that I was very fortunate to have survived an aortic dissection. And I was in a coma for about 3 or 4 months and had to rehabilitate and learn how to do everything all over again. And Washington Hospital Center saved my life. When I got out of the hospital and out of rehabilitation, my Medicaid had kicked in, and my Part D was paying for a myriad of medications that I had to take. My kidneys failed, so I am now on dialysis 4 hours a day, 3 times a week. Years, and that was in 2009. When it came time to repair that, because I had the coverage I had through the ACA, I could go to Inova Fairfax and have the stent put in that allows me to talk to you today.
All right.
And during that time, I found out that I would be diagnosed with prostate cancer, with thyroid cancer, had a pacemaker put in, and I saw the bill for all of this, and it was staggering. There's no way I could afford to pay that. It was millions of dollars. I was taken care of, and I am here, and we should not allow the people who want to change this to take us back to when they say America was great. America has not yet been as great as it's going to be.
Right.
And I feel a lot better seeing all of you out here.
Right.
I thank you for making me feel the way I feel. Thank you.
Thank you. That was beautiful. Thank you. And we're going to tell Ramiro's story, aren't we? We now have 2 wonderful guests from the Baltimore area here. I'm going to tell you who they are first, and they'll talk one right after the other. First is my wonderful hero, Dr. Lena Wen, the Baltimore City Health Commissioner. She is so great. She has come to Baltimore and really made public health a top priority for Baltimore. We love Lena Wen. and Baltimore County Executive Kevin Kamenetz, who's been a great fighter for public health in his time as county executive. And let me introduce first Dr. Lena Wen.
Good afternoon, everyone. Good afternoon. Thank you for sticking with us. I know it's hot in this room, and so I first have to think as an ER doctor. Hopefully everybody is well hydrated. You know, I'm not here as a Democrat or Republican. I'm not an elected official, although I thank our elected officials who are listening to our patients' stories, who are listening to Ola and Kevin and Romero. Weren't those amazing stories that we heard? I'm here as a doctor. I'm here as a patient, because we're all patients. We're all family members. And I'm here because the ACA is not a policy to me. The ACA is about my patients and about people's lives. Now, I want to tell you a story of my own. 8 years ago, this is before the ACA, I had a patient who was a 28-year-old man. He was the father of 2 beautiful little girls. He was born with a severe heart condition, and he needed medications to survive, but insurance companies wouldn't cover him. This is a story that many of you may have too. So he had a choice. He could pay thousands of dollars out of pocket every month, or he could pay rent and food for his family. But you know what? He chose his family, and he didn't get his medications. So the day that I met him was in the ER. Just before he came in, his heart stopped beating. That's how his wife found him. And his fluid was filling his lungs. So in the ER, we put in a breathing tube. We did everything we could to restart his heart, but we couldn't save him, and he died. So when I think about why we need the ACA, I think about my patient. I think about his little girls. I think about the millions of women who depend on the ACA for basic services like pap smears and mammograms. I think about the millions of people who are getting their heart disease, their diabetes, their high cholesterol treated for the very first time. And we haven't talked today yet about mental health, which is just as important as physical health. Do you know that just 1 in 10 people who have the disease of addiction, just 1 in 10 people are able to get treatment for that disease? Now, I mean, would we ever find it acceptable for any other illness? And Obamacare helps to provide coverage for people with the disease of mental illness and addiction. So I was in clinic the other day, and my patients are telling me that they're scared. One of my patients told me that for her, health insurance has been her rock. She said that getting insurance was what got her life back on track. And she's terrified that it's all going to be taken away from her. So I call upon all of us here to remember that the ACA may seem like a policy issue, but actually, it's because healthcare is a privilege, or healthcare should not be a privilege that's afforded only to those who can pay for it. Because all of us have a higher duty to protect those among us who are the most vulnerable. And no matter who we are, whether we're elected officials or doctors or patients or family members or members of society, we have to remember that access to health is access to life, and health is a basic human right. Thank you very much. Thank you. Oh, sorry. Should I'll introduce you. Sorry. In my excitement to rally us for health, I want to first thank again Benny DeMarco, our ultimate warrior leader. And I wish to now introduce another one of our tremendous leaders here in Maryland, here in Baltimore County, here in our country, and that's County Executive Kevin Kamenetz. County
Thank you, Dr. Wen. Thank you, Vinnie DeMarco. Thank you, SEIU. Actually, thank you, because you have done something special. You have come out here and stood up for an important issue, and literally, you're still standing up. You have done something more. You have inspired. You've inspired me. You've inspired every single elected official on this stage to stand up, be motivated, and know this isn't over. We're going to keep this fight going. You've inspired them so much, they've already left the building to fight that fight. Now, we have heard, so I say thank you. We have heard that there are 22 million people who are going to be jeopardized with the loss of health insurance. I want to bring it local. There are actually almost 500,000 Marylanders who are going to lose their coverage. There's going to be 1.5 million of your friends, of your relatives in this state who will be denied coverage for pre-existing illnesses. And there's going to be 41,000 sons and daughters who are going to get kicked off their parents' health insurance plan. Those are Marylanders. Those are all Marylanders. So I'm inspired. I'm looking for my relatives in each of those states. I'm figuring out how we're going to contact them. I know you're going to do that. Your friends, your relatives, anyone you know, write letters to the editor, write letters to the Washington Post, because those senators read that too. But I want you to do something more. When we're talking about those Marylanders who are going to be denied coverage, I want you to write to our governor. I want you to let him know he has to take a stand. Let him know that those 1.5 million people who are going to lose pre-existing coverage are Maryland citizens. Let him know that those 500,000 families are going to lose their coverage who live right here in Maryland. And if that happens, then Maryland's going to have to step up to the plate. What we need to do is have Governor Hogan go talk to his good friend, Mike Pence. Tell him to go talk to his new friend, Donald Trump. Tell him that Marylanders demand that he take a stand for Marylanders and fight our fight with his friends in Washington. All right. Now it looks like I'm the cleanup hitter here, and thank you all for doing this, but I'm just here. I'm making the pitch. The ball's coming right at you. It's now your job to hit it out of the park, and let's win this.
Thank you very much. I also want to thank again the members of the General Assembly who are here, Senator Paul Pinsky, Delegate Jimmy Tarlo. Thank you very much for what you do. Remember the 3 actions you're going to take. Number 1, make sure anybody you know who's uninsured goes to MarylandHealthConnection.gov and gets insured in the next few days of open enrollment that are left. Second, following up what County Executive Kamenetz said, go to Governor Hogan's website and demand that he do what other Republicans or governors are doing, is say to Congress, keep Medicaid intact. And third, contact your friends and relatives in these states. Is everybody going to do that today? Yes. And what are you going to tell them? The Affordable Care Act, Medicare, and Medicaid save lives and create jobs. Don't mess with them. And now I want to hand it back to our hero, Senator Chris Van Hollen.
Thank you, Vinny. I want to thank Vinny DeMarco. God bless Vinny DeMarco. He's been out there at progressive fights in the state of Maryland. I want to say to two other great fighters who are here. Paul Pinsky from Prince George's County. Let's give it up for Paul. Jimmy Tarlow. These guys, along with all of you, are fighting these fights in Maryland. And God bless the state of Maryland. I wish that the Congress of the United States had a legislature like the state of Maryland. Thank them very much. I just want to say to all of you, thank you for being here. We had a good problem today. We had people come bursting every room in this building, all of you in this main building. The others who are here on the stage, they haven't left. They've gone to another room close by. There's a big theater room for overflow because we had so many people that we couldn't fit everybody in this room, so we filled the theater right out there. And when that room wasn't enough, we had all our speakers go on the front steps where there were hundreds more people on the front steps. So I'm not feeling down. I'm feeling really good because I know the power of people and the power of people who get engaged, and I know you're going to help make sure that we say no to turning back the clock and we say yes to health care in America. Thank you. God bless you. Are you fired up? Are you ready to go? Fired up. Let's go.